Belizeans love fresh fruits and vegetables. If you will be heading to the market to stock up, please be sure to do so safely. Be sure to sanitize your hands at sanitizing stations provided at the market. Limit your time at the market by planning ahead and making a list. Once there, be sure to adhere to 6 feet social distancing at all times. Purchasing pre-packaged produce helps you avoid touching produce that other people have touched. Sanitize your hands often, especially after conducting monetary exchanges or touching surfaces. If driving, you should place purchased goods in a designated tray within the vehicle. When you reach home, properly sanitize your reusable bags. It's also advisable to properly wash and dry your produce before consuming or storing them. The Belize Marketing and Development Corporation, Ministry of Health, and market managers encourage all Belizeans to keep safe and buy local.
The uncertainties surrounding coronavirus disease may be stressful for children. They may react to fear and anxiety, which may lead to negative changes in their daily activities and behavior as a natural response to a stressful event. Some changes to watch out for in children include excessive crying or irritation in younger children, excessive worry or sadness, acting out behaviors such as temper tantrums, poor school performance or avoiding school, difficulty with attention and concentration, and avoidance of activities enjoyed in the past. There are things you can do to support your child. Take time to talk with your child about the COVID-19 outbreak. Answer questions and share facts in a way that your child can understand. Explain to your child the meaning and importance of social distancing. Also reassure them that it's for their own benefit and for those around them, especially older family members like their grandparents. Share with them how you deal with your own stress so that they can learn how to cope from you. Limit your family's exposure to news coverage, as children may misinterpret what they hear and can become frightened about something they do not understand. Try to keep up with regular routines. Create a schedule for learning activities and fun, relaxing activities. Take breaks, get plenty of sleep, exercise, and eat well. Deal with the COVID-19 calmly and confidently, as children in part react based on what they see from the adults around them. This is a message from the Ministry of Health.
How to put on and take off a mask. Wash your hands with soap and water for at least 20 seconds. Dry your hands with a clean paper towel and throw the paper towel away. Check the mask for any defects such as a tear or missing tie or ear loop. Throw away.
Belize now has over 700 reported COVID-19 cases, and our work continues to bring the spread.
Barrow to open up this afternoon's press briefing.
Thank you very much, Janelle. Good afternoon, everybody. I want to start by saying that, of course, the Minister of Health was scheduled to be with us this afternoon. By now, all Belize knows of the incident that took place last night, in which, following a home invasion that he suffered, there was a shooting. He, in fact, shot the person that broke into his home, and that person died. Now, of course, the police are conducting an investigation, after which, as I understand it, their report will be submitted to the Director of Public Prosecutions for her determination. All I will do this afternoon is to express my utter and complete solidarity with my colleague, Mr. Honorable Pablo Marin, and I will leave it at that. I should warn from now that when we come to the question and answer session, I will not take any questions on that matter, since it is an ongoing investigation. With that said, the way we propose to handle this afternoon's briefing is that Dr. Marvin Manzanera will first present to you. He will do the usual recap of where we are in terms of this continuing anti-COVID saga. He will give you the numbers. I know he does this pretty much on a daily basis, but I think for him to set out the situation in the round this afternoon at this kind of a forum, after which you can ask him questions, I think that will be useful. Then Dr. Russell Manzanero will speak to you about the epidemiological aspects of what's taking place. He will be followed by Dr. Goff. What I want Dr. Goff to do is to report to you on the inventory of our test kits and PPE. I also wish Dr. Goff to update you on the situation with the Ministry of Health staff, especially in terms of the number afflicted with the virus. Following from Dr. Goff, I will make some announcements. One other thing that I would want Dr. Goff to do, though, is to tell you about the bonus package for the frontline workers in the Ministry of Health. This is a bonus package that we had promised some time ago. We're finally looking to get it together. The position is being sorted out between the Ministry of Health and the Ministry of Finance, and so Dr. Goff will say a few words to that. When thereafter I make my announcements, as soon as I'm done, we will of course take all your questions. So with that, could I ask Dr. Marvin, I'm sorry, Russell will start? Okay, I'm sorry, Dr. Russell will start, Dr. Russell Manzanero. Thank you.
Where we're at with the numbers right now. So far, up to date, that is data that is being gathered up to date yesterday. We are now reporting 870 since the start of our first detected case. 385 in females and 485 in males. Of these, 93 have recovered. We have 12 deaths and 765 active cases. Just a further breakdown for you. Yesterday in itself, we have 52 new cases. So I'll break it down by how they came in. For Corozal, we have 18 new cases. In Caledonia, 5. Libertad and Corozal Town, 2. Chanchen, 3. Shaibe, 3. And Shunux, 1. In Orange Walk District, we have 14. San Pablo and San Felipe, 3. San Jose and Trial Farm, 2. Yo Creek, San Esteban, August Pine Ridge, and Orange Walk Town, 1. In the Belize District, Belize City, we have 5. We break it down, Biscayne, 4, and Keycocker, 1. For the Cayo District, Armenia, 3, Yalbak, 1, and in Belmopan, 1. I just also wanted to give a little bit information on the deaths. We do have 12 reported deaths, 4 in females and 8 in males. Basically what we're looking at the age group there is that from 25 to 34, we have 2 deaths. From 50 to 59, we have 4 deaths. 60, age group 60 to 64, 5 deaths, and 1 person over the age of 65. So for newly recovered, I just wanted to talk a little bit on the numbers for recovered. So far we have 39 newly recovered. That means from this, and I think the Director of Health Services will describe now how we are looking at that recovery, the case definition for that. For San Pedro, we have 21 individuals who have recovered. In Belize City, 9. Independence 2, Blue Creek, Corozal Town, Belmopan, Libertad, Las Flores, and Concepcion each report 1 recovered case. So from my end, those are the numbers.
Breakdowns, because I think once you start reviewing the data, you will notice that more males are dying than females. It's a 2-to-1 ratio. The recovery cases is also more females than males, and we almost have 100 more cases of SARS-CoV-2 in males than we do in females. So what we are doing in terms of the recovery situation that Russell has highlighted is that in the past it used to be 2 negative tests that were being done. Keeping in line with what's reported internationally, we are now only doing 1 test. Once that test comes out to be negative, the person is deemed to have recovered, and that's why we're starting that process of reporting as of today. The lab has also confirmed with us that they have now caught up on all the backlog of samples that they had. They completed that with yesterday's 335 samples that they processed, which is the second highest amount that they have done in one single day, so that they are now processing samples from the day before. So they have caught up with all that backlog. So the turnaround time we anticipate is going to improve as we move along. Just as a reminder as well that we are using gene export technology for all those critically ill patients, be it in the public or private sector. So once anybody who is critically ill or has a high suspicion of SARS-CoV-2, those are processed through a separate template, and the turnaround time is much quicker than the PCR test. And private sector and any public facility will have access to those levels of testing. We had mentioned also last week that we were changing the way we were doing repatriation processes, which means that the people who arrived last week Friday are being swabbed today. I believe it's 92 persons or 90. And so that those samples will be processed throughout the weekend, and we should have those results Monday and make a determination as to whoever is positive, how many more days they need to stay, and whoever is negative, they'll be able to leave the hotel quarantine. And again, as we move along with changing guidelines based on evidence, based on science, the situation of repatriation persons arriving may actually change next week with the next repatriation flight. Again, we're guided by science. I know that people keep saying, why does this seem to change as we move along? Well, there are many things we didn't know when we started this process, and as you know, situations guided by science, those are going to change. In terms of where we are with our numbers, we are currently ranked in the total listing of countries. We are 163, in the ranking of total number of cases of SARS-CoV-2. But when you break it down by rates, Belize is at number 96. At the death rate in which we are based on the deaths that we have per million we are at number 99. And I think we want to stress out the situation in terms of testing, because we keep being told that we are not doing enough testing. However, reviewing the data that does not include today's sample that Russell has just reported, we have similar testing rates as Ecuador and Jamaica that have higher numbers than we do, and we have higher testing rates than people who have similar epidemics such as ours and similar population characteristics such as Suriname, Guyana, Trinidad and Tobago, and in our neighbors we have higher rates than Honduras and Guatemala, and we almost have double the testing rate that our neighbor Mexico has. I can tell you that we are done for the second week in a row. We have been able to test with PCR technology people who are leaving the country and who require a test. This is primarily for students and people leaving for medical reasons. In terms of healthcare workers, I do think we need to make this situation clearly visible for everybody. Unfortunately, we have our epidemiologist from the Western Hill region has been intubated and is connected to a ventilator at Carl Huchner. That happened yesterday. That's after he was there for 24 hours. The total number of persons we have in terms of healthcare workers that have been tested positive for SARS-CoV-2 is now 36. 10 of those have been in the private sector, 26 in the public sector. 1 person has recovered from the private sector, and 2 persons have recovered from the public sector. And it's important that we highlight this because in this healthcare workers, we are classifying doctors, nurses, X-ray technicians, pharmacists, laboratory technicians, and in some instances administrators, depending on the work that they do. One final note only, and this is in terms of exposure, because we keep getting this note that who is a close contact and who is a casual contact. Just to go to the basic situations that you really should all avoid, and we should all avoid as much as we can. Crowded areas, whoever is a close contact, of course, when you're at home, you may not be able to shy away from that. Minimizing your continuous exposure to any potential suspect case, wearing a face mask whenever you are close to somebody that's not in your immediate social circle. Closed spaces, we all know what rate of transmission you can have. And I know that we are reviewing, I believe Prime Minister will mention that even the notes that we are getting in terms of rapid testing and where we are going to go. Because we are reviewing the science, we are aware of the new notes that PAHO has released earlier in the week, where there's an opening for us to go back and review our testing algorithms and have rapid testing be made available for certain areas and sectors of the population. Again, depending on what you have identified, I think the discussion we had earlier was whenever you have documented community transmission and that you're not routinely testing everybody, that there may be a room for doing rapid testing on the symptomatic persons, or in a household where you have identified a case, test with a rapid test that's been validated at the lab, and then you have to do the validation on the field. I think there's an opportunity there. One final note from me, going back to basic statistics and the physiology of the disease, you do know that you would require on average about 1,000 viral particles to have been exposed to 1,000 viral particles to come in either through your eyes, your nose, or your mouth for you to then develop disease. And just so that you can see the value of wearing a face mask, every time you breathe, you are releasing on average about 20 viral particles. Every time you're talking, you are releasing about 200 viral particles per minute. A cough will release about 200 million viral particles. So if I cough here and I don't have my face mask, then those 200 million viral particles can potentially be suspended. And if you have an AC like the one blowing behind me, can just spread out in a room like this. When you sneeze, you also release about 200 million viral particles. So even the issue of having a discussion, if you do this basic math, then 200 viral particles per minute, and that's why I think in the close contact situation, if I'm having a conversation that lasts 5 minutes or more with somebody else that is not wearing a mask and I'm not wearing a mask, then that's when your risk starts to increase. That's what I have. I am assuming that we'll be able to address all the concerns. From our vantage point, from the Ministry of Health, we are still asking that we have a single unified front versus SARS-CoV-2. I think it's rather unfortunate that we sometimes get singled out for everything that's not being done. But the staff that's on the field on a daily basis until late hours of the night, I think should be appreciated. The lab people working till 1, 2 o'clock in the morning to make sure that all the backlog has been completed. I think we need to start to show that single unified front that we need in terms of being able to address SARS-CoV-2 successfully. Those are my notes, Prime Minister.
Thank you very much, Doctor. Dr. Goff?
Sir, good afternoon. I want to talk a little bit about the current assets the Government of Belize has to fight COVID-19. In the last few months, we have enjoyed the full support of the Ministry of Finance, where we undertook the use of initial purchases of PPEs, some equipment, and obviously some development of different infrastructures within our clinics, especially the regional and community hospitals. I'm glad to say at this time that all those upgrades of flu clinics within the regions have been completed. Also, I want to say that at this time, between the accessing of the $6 million from the IDB loan and also starting to access the donors' contribution that have come into the country, we find ourselves in a very responsible position to be able to report to the nation that when it comes to the PPE suits, the ones that you see in the full white, we presently enjoy an inventory of about 100,000 in country in our warehouses, and we have about 15,000 still coming from an IDB subsidy. Not to say that we are going to be issuing them recklessly or irresponsibly. When it comes to the gowns, for example, I'm glad also to say that we have more than 34,000 of the blue ones, which are the sterile ones, and we have over 20,000 of the non-sterile ones, and we have a total about 75,000 still coming into the country. When it comes to the mask, like the one I'm wearing, we presently enjoy close to 1 million in the warehouse, and I have close to about 700,000 coming in the next few weeks. The N95, which are very demanded upon due to the contact tracers and the people doing the swabs, the healthcare workers in the ICUs, the workers in the operating rooms. Presently, we have a total of 11,000, and we are looking at close to about 100,000 coming in right now from the donors of IDB and the Taiwanese grant. The K95s, which is a matchup close to the N95, which is a very good mask to be used in a clinical setting, we also enjoy a surplus of close to 100,000 coming our way, and presently we have about 144,000 also for entry within the country, which we have them presently now in both warehouses in Belmopan and in Belize in Ladyville. The nitrile gloves, the blue ones that people will see that our lab people use, some of this is being demanded now from the ICU units. I can safely say we have close to 258,000 in the country, and we have 500,000 coming also in the next 4 to 6 weeks. Gloves, the disposable gloves that I'm sharing with all the healthcare workers and the law enforcement agencies and all the support groups like immigration and customs. We are presently enjoying close to 1 million gloves we have in country, and we have 4.1 million coming. When it comes to goggles and shields, I enjoy 20,000 goggles presently. Those are the ones that can be reused, and the shields we enjoy approximately about 60,000. I have 10,000 coming from a Taiwanese grant. The alcohol, the liquid soap, the medical soap, the peroxide that we use in individual forms or to create mixtures of what we call hand sanitizer, I'm presently in country. I have about 140 to 150 drums of each, and I have an additional 100 to 150 drums coming also from the Taiwanese grant. Those we are sharing with the Ministry of Education. We have given them so far about 30 drums, and I've been sharing half a drum here and there with other ministries like Immigration, Customs, and the Coast Guard, BDF, whatever they request. Now, we're looking at a couple of things here. We are aware that we're going to be faced with these cases that are going to be coming at us within the different institutions. And obviously, we are mindful that this supply cannot last forever, but we are quite confident that it will take us at least into the next 9 months at our worst case scenario. Also, this does not include the tendering process that we undertook earlier this year, which does not have this type of quantity, but do enjoy about 15 to 20% of the numbers that I cited within our normal purchases that we do during the year of other materials, but these being COVID-related materials. I want to now bring to your attention about the test kits. The Prime Minister mentioned to me early on that he wanted me to be a little bit more descriptive here. Presently at the lab, at the central lab, or PCR, not the rapid, the solid PCR testing that we're doing, we enjoy presently a stock to be able to do at least 26,000 tests in the country. That is a very comfortable point and position at this time if we are to change our protocols a bit slightly. With rapid antigen tests, we also had the foresight about a month ago to bring in 5,000 rapid antigen tests that we have quietly stored at our labs. We are presently procuring, as I speak, yesterday and Monday, another 10,000 that should be in country by later next week. That money has already been secured by the Ministry of Finance. And this morning, I got a note from the EU PAHO with an offer to get another 10,000 if we should accept later on today by official correspondence. So that would put us in a position of 25,000 rapid antigen tests. 5,000 in country, 10,000 by the end of next week, and in 4 to 6 weeks, the other 10,000. We also have in country the good donation from the Brothers of Taiwan that we got about 6 weeks ago, which is the rapid antibody test, which is the IgG/IgM. We have them on store. The Director of Health Services desk has expressed a special interest for us to use that eventually. And also this morning we got the news that Sedima from the Caribbean were very kind to donate 2,000 more rapid antibody tests of the same type. So now we're sitting on a stock of 7,000 antibody IgG/IgM tests in country with expiry dates of 2022. So we have time to make good decisions how we can use them. Now moving on, the Prime Minister had also asked for us to look at exactly what had happened to our staff. I think the Director of Health Services beat me to the punch on that one just now. We basically are looking at the 28 healthcare workers now from the 26, and a total of 38, and also with law enforcement we have 42. But I just want to emphasize that it's not the doctor, it's not the nurse. It is the lab technician, it's the pharmacist, it's the receptionist, it's the administrator, it's the lab technician, it's the public health inspector, it's the x-ray. Everybody is exposed. So everyone possible within that healthcare team has come up, there's somebody represented them on a positive note. So we are very, very concerned, and obviously we are even looking at our protocols to say that maybe these people that are on the front line might need to wear an N95 mask, something that we know is much more expensive, but we are starting to learn and observe that these people are much closer to these clients than what we are presently, and maybe by not having an ordinary surgical mask and an N95 mask, they probably would be more protected. We have taken measures from the last source of funding that I have gotten from the Ministry of Finance to make an effort to procure more N95, especially for those people that are on the front line doing the contact tracing, doing the swabbing, and actually doing the clinical work within the flu clinics or in the ICU units. So I think we're going to add that layer of extra protection, even though it's going to cost us a bit more. What are we doing now to renew the staff? Basically, early on this year, the Government of Belize, through the Public Service and the Ministry of Finance, had sent out the normal circulars that when you reach a certain age, you have to retire, mandatory retirement. When you reach a certain age, there are certain professionals that we would have to look for. COVID has changed all of that, and along with the full support of the Ministry of Finance. So I must tell you that everyone that I have requested in the last month and a half to 2 months, from the Northern Health Region, 2 specialists, 2 medical officers, 4 nurses, 6 support staff, that either would have been new, would have left the post, or would have retired, I have gotten them back. From the Central Head Region, again, 4 medical officers, 2 medical technologists, 6 rural health nurses, 1 midwife, 6 support staff. Again, either have retired, they would have moved on, or left, or hired, I got them back. I also got temporary hires from PAHO for 3 to 6 months, for 6 to 8 nurses. I also managed to get the rural health nurses that were going to retire in the Belize River Valley retired, to be rehired again, back on the team. Western Health Region, again, 3 specialists, the medical officers, the staff nurse. The Ministry of Finance even went above and beyond to what do I say, not to object, but not to concur with their own circular that even I was given permission to pay the 1-month holiday so they can remain working. So we asked them, don't go on holiday, stay working, I'll pay you the holiday, something which we try hard not to do because we believe people should go on their leave. In the Southern Health Region, we got back the 3 specialists, the 4 medical officers. In Toledo, we had 4 medical officers, a staff nurse, 6 support staff. In headquarters, we went ahead with a surveillance officer that was going to retire. We got her back, we got her leave paid. I was glad to say that yesterday the Medical Council made a decision, like we say, to graduate our young doctors that come from Cuba 1 month before the 12 month, so we could put them to work on Monday. So of the group of 8, I managed to get 3 more that will start on Monday wherever the Director of Health Service deems that they are needed. Now, what has happened now with all of this is that the Honorable Prime Minister had also mentioned that he would make sure that the healthcare workers, or the frontline workers, I don't like to say healthcare, frontline workers, that were fighting COVID, especially in the areas of what we considered the battleground, like the work in the flu clinics, the staff that was doing the surveillance, the staff that was doing the contact tracing, the PHIs, the ICU teams, the lab team, and I could go on. He had committed to some form of I have to be careful of the word, an ex gratia payment, a payment that to say thank you very much. Obviously, we were battling with the idea of the overtime because historically we have been short in the past with different professional groups in healthcare. So the overtime had become a bit monstrous, and in the last 3-4 months we had tried to contain it. And a circular had gone out to say only 20 hours, but we found out that at least 60-70% were doing more than the 20 hours. Again, the Ministry of Finance was very gracious to retract on the circular and put out a new circular saying, okay, not 20 hours, we will pay you 40 hours. So we went back and we said, okay, June, July, August, who made more than 20 hours, recalculate, and we are now paying them the difference on the 20 hours. And now I'm pleased to say that in a discussion with the Financial Secretary yesterday, the Ministry of Finance has managed to put its hand on a very limited amount of money, but yet substantial, for us to look at the list from every region, from every clinic, from every flu clinic, from every institution that has contributed somebody on the front line when it comes to the healthcare system, and also with Carl Hushner, to be able to come up with a list for us to be no later than month's end in September. I am begging at least 2 weeks because it takes a lot of due diligence for us to be able to pay that payment that the Prime Minister had promised to the frontline healthcare workers. So I'm pleased to say that it will be done no later by month's end, sir. And that's what all I have to say, sir.
Thank you very much, Dr. Goff. I think that was an extremely important message. I know that on the last occasion, there were questions asked about health workers, staff shortages. I believe that you would have succeeded in allaying the worst of the fears in that regard. I really appreciated your going through it step by step and actually listing the places where we are asking people not to retire. We are doing new hires, and you certainly ended it up splendidly by indicating that by the end of September we will be providing this bonus payment, if you will, to all those to whom we are so greatly indebted and who have worked in such an unstintingly selfless way to serve the government of Belize and, much more importantly, the public, the citizenry of Belize. So thank you very much indeed, Dr. Goff. Now, for my announcements, to some extent, Dr. Marvin has touched on what I want to speak about, but I will do so in some greater detail. With the recent surge, the number of tests done has become, comparatively speaking, astronomical. It is clear that we are being overwhelmed in terms of our capacity constraints. We only have one central lab, a few regular PCR machines, and a limited number of trained operators to process the samples. Thus, the situation has now overtaken us, where, outside of obvious emergencies, people have had to wait some considerable time to be swabbed, and perhaps even longer to get results. I was very pleased to hear Dr. Marvin indicate, I'm not sure if he said it just now, we had a meeting this morning prior to coming here. And if he didn't say it just now, he certainly said it at this meeting this morning. We are basically working down the backlog that ensued in consequence of the surge and in consequence of what I called this astronomical rise in the tests that we have needed to do, the swabbing we've needed to do, and the processing of samples that we have needed to do. Still, for example, I don't think we're completely out of the woods. My point is that in any event, you are going to see, as from this weekend, a lessening of the waiting times, both for swabbing and for test results. But over the weekend, or I think perhaps yesterday, people already set out, members of the health team, to Orange Walk. And there are additional swabbings that are going to be done to the tune of a couple hundred, I believe, Dr. Marvin. Thing is that from the additional samples then that will in consequence be processed, we don't know how many people will turn out positive. And once there are positives, then the chain that we think we're close to breaking, in fact, confronts us all over again, because we then have to test the contacts of those that prove positive, and when in terms of those contacts, some of them prove positive, then we have to go on and test their contacts. So we're testing contacts and contacts of contacts, and that is what produced the untenable situation that we've been experiencing and about which I just spoke. Now, of course, the problems are not peculiar to Belize. Indeed, very many of the major developed countries, as you know, are encountering the same problems, and those problems are in fact prevalent in the Caribbean. Currently in Belize, all testing is done by way of this gold standard PCR platform, either the regular PCR platform or the GeneXpert platform. We have less tests of the GeneXpert variety. The difference between the GeneXpert and the regular GeneXpert platform and the regular PCR platform is that the GeneXpert gives you the results in a shorter period of time. But all our tests are done by way of one of the two PCR templates, one of the two PCR platforms. All right. In the best of circumstances, before, for example, this latest surge, those tests, leaving aside for a moment the GeneXpert, the regular PCR tests have a turnaround time of 18 to 24 hours, sort of thing. Right now, before we've reached this point where, according to Dr. Manza, we're beginning to work down the backlog, right now, as you know, there are some results that are taking 4 days, perhaps 5 days, that sort of thing. What is a development that we have not tried to take advantage of for several reasons is the fact that several brands of antigen and antibody rapid tests have come on market, have come to market since the global spread of COVID-19 began. I won't get into the difference between the antigen and the antibody, but the antigen is the rapid test that's preferred in terms of trying to detect whether the testee, the person being tested, in fact has the virus. Now, these rapid tests, and let me talk let me concentrate my remarks for the time being on the antigen rapid tests. Some of these antigen rapid tests have a turnaround time of as little as 15 minutes, as opposed to basically the 24 hours for our regular PCR tests, and the perhaps 3-4 hours for the Gene Expert PCR test. So here it is that we have all these antigen rapid tests that give you results in as little, or can give you results in as little as 15 minutes. The problem with our not having resorted to the use of these antigen rapid tests is because there are reliability issues with pretty much all of them, and the seriousness of these issues differs, of course, from manufacturer to manufacturer. But in the end, it is sufficient to say that no rapid test, we're dealing with the antigen type, but even with the antibody test, no rapid test has reached equivalency with the PCR test. And that is why in Belize we continue to place all our bets on the PCR test. No rapid test has reached equivalency with the PCR. None, that is, until now. Yesterday, as you in the media will know, news was globally circulated about the breakthrough development of and FDA clearance for the Abbott Labs Binax Now rapid coronavirus antigen test. That test is 97.1% sensitive, meaning that it correctly diagnoses those with infection, those tested. It correctly diagnoses those tested that do have the infection 97.1% of the time. It is also that new Abbott Lab Binax Now rapid coronavirus antigen test. It is also 98.5% specific. You're dealing first with sensitivity, then you deal with specificity. And what that means is that an infection is correctly ruled out 98.5% of the time. This high degree of specificity deals with the problem of false negatives, and it is this probability perhaps, of false negatives that has been the bane of other rapid tests. It therefore now puts the Abbott rapid test right on par with the PCR regular tests. Of course, we understand that President Trump is to announce a $750 million US deal to acquire 150 million of these tests from Abbott for use in the United States. That sounds as though basically Abbott will be producing primarily, hopefully not exclusively, for the US market. Abbott has said that it will be shipping the tests in the tens of millions next month, right here, September, starting next week, and would increase to 50 million tests per month starting October. I repeat, the question is whether and how soon small countries such as Belize will get this test. PAHO, we are informed, is seeking to source a supply for the region, but it is too early to know about success. It is too early to know about timeliness. Meantime, though, PAHO has sought to address the current problem of the testing bottlenecks that Belize, such as Jamaica and the Bahamas and others, Belize is facing. In a paper dated August 24th, 2020, PAHO recognizes that in the face of our outbreak, an objective now must be to decentralize testing, to provide access to point-of-care diagnosis for COVID-19 at the community level, at the outpatient services level, and at the remote areas level. Thereby, PAHO is saying there's a need to increase the daily number of samples processed and the turnaround time for results. The only way to do this, PAHO more or less concludes, because PAHO is very careful, and whatever they say, they will try to nuance to death. One understands that. But as I read their paper, the only way to try to achieve the objectives that they've set out is for a country such as Belize to have recourse to the antigen rapid tests as a means of supplementing the PCR tests. Accordingly, PAHO says that while antigen detection cannot completely replace the PCR detection, antigen testing should be considered in certain cases. Indeed, they should be prioritized. PAHO's word, not mine. They should be prioritized for the following: the testing of suspected cases that appear to be symptomatic, and the testing of contacts of confirmed patients. In suggesting this course of action, PAHO is careful not to dismiss the worry over false negatives. Indeed, it warns that negatives must be carefully evaluated and may require a backup PCR test in the interest of certainty. Also, PAHO admits that it has not itself validated any of the antigen rapid tests currently on the market. It does, however, point to two that it describes as having, and I quote, shown promising performance. Both those tests are manufactured by the company SD Biosensor. Now, the National Oversight Committee had already discussed the possibility of using the antigen rapid test in the manner that it now turns out is being canvassed by PAHO. At the time the NOC last met on Monday of this week, though, that PAHO report had not yet come to hand. It may already have been written, but we certainly did not have sight of it. So, not having had the benefit of that PAHO bulletin, if I may call it that, while we clearly leaned towards use, we at the NOC, while we clearly lean towards use of the antigen rapid tests as part of our national testing regime, we postponed a decision because we thought it such a fundamental one as to require further examination. Now, though, up comes this PAHO bulletin to nudge us along the path we were in any event contemplating. Further, as Dr. Goff told you, GOB had already bought 5,000 of one of the very biosensor tests that PAHO reviewed as promising. We yesterday, again, as Dr. Goff told you, confirmed availability and ordered another 10,000 from our supplier, who's in Guatemala. And then there is the further 5,000 or so, another 10,000 that who is giving to us? The European Union is providing to us also through PAHO. What this means is that I am able to announce today that starting perhaps I think as soon as the samples come back from the sweep that's being done in the north this weekend by the health workers, perhaps as soon as that, when we see that there are positives, we will begin to use one of the biosensor antigen rapid tests as part of our testing regime. Now, remember what Paho is saying. You use the antigen rapid test to test the contacts of those that are proved positive by way of the PCR test. You also use the antigen rapid test for people who, as they say, are ambulatory, are able to walk around, but that exhibit symptoms. You test those people with the antigen rapid test. That clearly eases the load on your PCR testing capacity. The particular biosensor antigen rapid test that we will use produces results in 15 to 30 minutes. If you go and look at it, you will see that there is actually a little audio visual, a video provided that shows you how the particular one that we're using operates. It produces results in 15 to 30 minutes, and it obviates any need for processing by our overworked central lab. It needs no operating equipment. There are some of them that come with a little machine that does the processing. This one that we are using is altogether self-contained. So you need no additional equipment for operational purposes. It can be, the processing of the sample is done in this very basic way, and you get your results, I repeat, in 15 to 30 minutes. The benefits of adding the antigen rapid test to our arsenal are, I believe, you would have seen, obvious and plentiful. Of course, it is not a panacea. We will still test all frontline workers with only the PCR, which remains the gold standard. And there is the question of how to backstop the possibility of false negatives with the rapid test. We can do that by either, as Dr. Manza, Dr. Marvin, I believe, suggested earlier, we can do that by deploying a second test using PCR after a negative rapid test result. If somebody comes in, remember we're going to be testing symptomatic persons, contacts of those that have been positive. So they're already extremely suspect. You use the antigen rapid test, they prove positive, that's it, punto final. That's you can take that to the bank. But if they're negative in circumstances where it suggests to the tester this may be a false negative because the person is exhibiting pronounced symptoms, the person was in extremely close contact with someone already tested positive by PCR, then there arises perhaps this need to do a second test to see whether in fact the negative result given by the use of the antigen rapid test is in fact a false negative. We can do that second test, I repeat, as Dr. Manza said, by using the PCR, but then you start getting back to the problem of possibly overcrowding the PCR. You can also do the backstop by administering a second rapid test. In fact, we're thinking about, while the biosensor is our rapid test of choice, Dr. Goff told you, we also have another rapid test, the Sophia 2 rapid test. We may either backstop the use of the biosensor rapid test by administering a second test in the case of a negative that we find suspicious, a second rapid test, perhaps using Sophia 2, or a second rapid test using the very same biosensor. And the reason why I say one possibility is to retest employing the very same modality of the biosensor rapid test is this. A statistician has said to me, look, this is the formula. If a process has a 10% chance of failure, then the confidence level of the result on the first attempt is 68%. If repeated, the confidence level increases to 95%. And if done a third time, it would produce a confidence level of 99%. Now, there are other variables, how you test and the competence of the person doing the testing, the swabbing, all that sort of thing. But you get to a confidence level of 95%, you're home and dry. So that would be, to my mind, an acceptable equation. Of course, the doctors, Manzanero, and their team of experts at the Ministry of Health will have the ultimate discretion to decide whether, in any particular case, the rapid test, the rapid antigen test guardrails will involve additional testing by the same rapid test modality, I repeat, of the rapid test, or by the PCR method. They will make that ultimate decision. The bottom line, though, is that either way, using the antigen rapid test in the way I have described will provide substantial relief both to those doing the testing and to those being tested. We were, in any event, I repeat, according to the doctors Manzanero, beginning to work through the backlog, so relief might have been on the way no matter what. But because we can well return, depending on how, what the number of positives we get from these final sweeps, of sampling and testing, because we could well return to the situation that's confronted us over the past 2 weeks or so, it is, I think, an absolute step forward. It is a clear positive for us to be able now to say we will use the antigen rapid test, which, once there is any sense of a return to the overcrowding, will provide us with the relief we need. We can therefore, this afternoon, reassure the public that the days of waiting unduly long to be tested, the days of waiting an unduly long time to get the results once you're tested, those days are pretty much behind us. So that's it in terms of the use of the antigen rapid test. My second announcement is about the Pgia reopening. I'm pleased to say that we have a firm date now of October 1st, 2020. This date is what we have fixed upon for two reasons. We are positive that all the protocols, the physical refurbishment or the physical alteration of spaces at the PGIA, the training of taxi drivers, the training of others, the continuing or continuous reaching out to the immigration personnel and the customs personnel and the public health inspectors, that sort of thing puts us in a position where we can say with complete confidence that by October 1st, we will have the kind of flow that is to take place through the Pgia down pat. So, apart from knowing that by October 1st we will absolutely be ready, the second rationale for that date is the fact that it would have made no sense, even if we could have managed it, to do an earlier reopening because nobody was coming. We have now, though, confirmation from American Airlines that they will start to fly again to Belize on October 1st, 2020. They will come initially 5 days a week, every day except, I believe, Tuesday and Wednesday. Is it Tuesday and Wednesday, Audrey, or Tuesday and Thursday? Anyway, 5 days a week. And then United is also indicating that they will start coming back to Belize on a regular basis. They bring the repatriation flights every Friday, as you know. But they will start coming back on October 1st, and they are proposing to come every day. Am I correct, Audrey? Is that the last? That's the last email we got from them. So October 1st it is. Delta, that had earlier asked for September 3rd, even before we made a decision that we couldn't go September 3rd, they're having, I suppose like all other airlines, but they're having pronounced problems, and I've just seen where they announced cutting back on domestic and international flights. In that context, they have said that they will not come until November 22nd, I believe it is now. But that's a good enough start. American 5 days a week, United 7 days a week as of October 1st, and within 6 weeks or so thereafter, Delta coming directly from Atlanta. We're not yet sure how many flights per week. Now, barring a hurricane, there is no way that opening date should change. And here's why. By that time, the Abbott rapid tests that I earlier spoke about should be in plentiful supply, certainly in the US, our great source market. So American tourists and Belizeans coming back from the States should have no trouble bringing an Abbott test with them. This thing is so portable. I don't want for them to test in the States and bring us the results of their 15-minute Abbott test, you know. I want them to bring the test and have the test administered right there at the airport so we can see. There won't be any logistical problems because this is 15 minutes and you're good to go. But what it means, whether they use the Abbott test in the States before they get here, or whether they use it, as I would prefer, once they reach Belize and disembark, this should cut at least by half any worry we previously had about being able to find sufficient tests to be administered by us at the Pgia. It also means, even though Dr. Goff has told you we're doing well enough with respect to our numbers, but it should also mean less health staff having to be deployed at the Pgia to swab and process. Now, one last note. In my view, that Abbott breakthrough should also mean a 2020 restart to cruise ship calls, since it will be so easy for the cruise lines to test passengers before they board. You know that the majority of the cruise lines, certainly all of them that come to Belize, have said that they will not start cruising again until 2021. But that was before this Abbott test breakthrough. They're Americans, or basically, or they're headquartered in America, so they will have access to the Abbott rapid test, and that should mean they're able to test every passenger. In terms of the numbers that Abbott is saying, the way in which they will mass produce this test, it should be no problem for the cruise lines to be able to test everybody before they board a cruise ship. And so it strikes me, I haven't seen this said anywhere, but it strikes me that this will have to mean a reversion to a 2020 restart for the cruise industry. They're burning through cash like mad, and they are doing all sorts of borrowing, all sorts of leveraging, and so clearly anything that will give them a chance to start a return to profitability, or at least to money making, I'm sure they will seize on. It would then mean, if I am right, that the Abbott test breakthrough should also have an influence, should also incentivize an earlier start for the return to cruise. That basically we are beginning to see a comprehensive, at least the possibility of a comprehensive reset for the entirety of our tourism product. Now, of course, the deadly volatility of the pandemic has taught us that we should be very leery of declaring any sort of victory, economic or health. But I don't think it premature to feel that our stars will soon commence coming back into alignment, and not a moment too soon. I will stop there for questions. All of us, of course, are prepared to take your questions, all of us at the head table.
All right, thank you, Prime Minister. At this time, we'll invite the media for the Q&A session. We ask that you get straight to the question, please. We do have quite a few people online today, so each person will be allowed the initial 3 questions. If there is an absolute need for a second round of questions, you will be allowed 1 question each. That's 3 questions, Jules. So we'll begin this afternoon with Courtney Menzies from Love Television.
Alright, I guess I have my own question. How would you respond to Dr. Victor Rosado's comments earlier this week during the CDC statement of under health fund that they have about Belize having failed health?
I didn't hear the good doctor, and I'm not about to get into any political back and forth with him or his party. Look, all I will say is this. From what you report, he seems to be talking about the health system generally. And I'm sure there have been challenges over the years. We, in the Ministry of Health, in the Government of Belize, are concentrating our efforts on dealing with the pandemic. Anybody that suggests that our dedicated professionals in the Ministry of Health have not been giving of their absolute best needs to have his or her head examined, and certainly would be doing an injustice to the Ministry of Health personnel, to all frontline workers. Health apart, this government is focused on trying to deliver core services to the people of this country at a time when the contraction in revenues makes that difficult. Just yesterday, you had the Minister of Agriculture give a press conference. You had confirmation of the $8 million that I talked about from the start when I first got in touch with Madam Tassin Said Khan at the World Bank. That money has now come on stream, apart from the $13 million that already is being disbursed for assistance with social protection. Ministry of Agriculture has restarted the cattle export, this time in a perfectly legal and legitimate fashion. I just saw from Dr. Barnett that phase 2 of the unemployment relief program is now really getting up to speed. We've sorted out most of the kinks. Again, there is still something like $40 million or so in that unemployment relief pool. We just had approved at the Parliament the loan motion for the $10 million that we're getting from OPEC for the continued rollout and expansion of the food assistance program. We got monies from other IFIs. Certainly the IDB helped both with unemployment relief, and the World Bank certainly has assisted with respect to the food assistance. So there's this confluence of funding sources that this government has been able to unlock, and that has put us in a position where, of course, everything isn't perfect. But in all the circumstances, we have been able to deliver on the basics for the people of this country. We have not fired a single public officer. We have not cut a single public officer's pay. That continues, has been, and will be, up until the calling of the elections, the focus of the government of this country. And basically, I have no time to deal with the naysayers.
My second question, San Pedro is no doubt one of the major tourist destinations in Belize, and soon the airport will be reopened in the next couple of months. Is there a possibility for the lockdown to be extended to ensure that the cases are contained or more controlled?
I don't see that. Of course, we will be guided by the numbers. I believe when Dr. Manza gave the breakdown, I don't know which of the Dr. Manzas, the last count from San Pedro or the number that proved positive from the last batch of samples is a small number. I would want to believe that Ambergris Caye is plateauing, and so I certainly expect that we may be able to lift the quarantine even before it expires. And remember that it's coming to an end in any event. When we went to the House, all we did was to have an extension for 2 weeks. So in my mind, there is very little likelihood, it's next to impossible, that we would be faced with a situation where by the time we open the PGIA on October 1st, San Pedro would be under any form of quarantine.
And this is the document, there was an app in the development to calculate children up based on that, on the budget of the app.
Can you repeat the question? I just want to, if I understood correctly.
Okay, we know that there have been developments, I believe to structure country in the country and other they have to sign up for the requirements to come into the country. Is there any update on the public of that act?
Sure. The Belize Health app, which is, it is an app that should be filled out prior to entry. Now, the way how it was discussed was that it was supposed to be for health, immigration, and customs, and to move away from paper-based methods now, and everything should be automated. We have been part of the discussions for the position on health, so I really can't tell you how far it is with the immigration and customs. From our end, what we're trying to do is to ensure that what is being captured at that entry point can actually be channeled and complemented with what we have, so that we can have an adequate case management of each individual. Now, mind you, this is basically for those who are returning Belizeans, residents, and second home owners that we would want to follow. As visitors, more or less, we would be capturing but not be able to follow them or do case management since they won't be staying long in the country. So that is still something that is being looked at. We are working with the SIB, they're the other counterpart that we've been working with, to ensure that the app is in itself making its way forward. There are still some pending, but it's very little, so we are to have that up and going. So we're to finalize that with SIB.
Okay, thank you everyone.
Thank you, Courtney. Next up is Mr. Vasquez.
I didn't expect to be called on so early. Thanks very much. First question, Mr. Prime Minister. I heard you speak about phase 2 of the unemployment relief program, but out here the social desperation is very high, and the impatience is also very high. People are impatiently waiting for the disbursement of this second tranche of the unemployment support. Is there a date of when people will start to have this money in their hands?
Told me, so I imagine as from Monday. Remember what happened? SSB withdrew. Remember in phase 1, it was SSB doing the processing, but quite properly they said that they have their own duties at their institution, and so we're now partnering with the National Bank of Belize. We're using that digital wallet, are we, Audrey? In any event, and Dr. Barnett's ministry now houses the sort of secretariat that is to oversee the program. It is true that because of the change over from SSB to, in effect, the Ministry of Labor and this specialized secretariat, there has been a little bit of a lag, and I apologize to people for that. I want to express my sincere regret. People, you're right, are absolutely desperate, and it is our duty to get relief to them as quickly as possible. But it's starting to happen now, and it will happen in a way that will absolutely outdo what was taking place under phase 1.
Okay, thanks. Regarding the situation where persons return home, Belizeans return home, have to go into quarantine immediately, there is growing impatience with this because it is understood that when Belize was down the lockdown, and we had no new cases for all those days, or very few cases going up, 1 or 2 a week, that we were forestalling the introduction of a looming threat, which was an outbreak. But now, since we have an outbreak, and I know that has a scientific meaning, but I think it has 1,500% increase in the past 4 weeks. So if there is no longer the looming threat of an outbreak, it is a present danger, which is with us right now, why still subject returning Belizeans to a mandatory and quite costly quarantine when, you know, they can just self-isolate at home, like the many hundreds who are COVID infected are expected to self-isolate at home?
Well, I could argue with you, you know, because it's one thing to have this organic, as it were, development of the community transmission that we experienced over the past couple of weeks. It's quite another to add to it by running the risk of imported cases of the infection. But I don't think we ought to spend too much time on that. You already heard Dr. Manza say that everything is fluid. We look at the empirical evidence of what is happening. We then filter that through the science and the developments that are taking place globally. Long story short, the doctor said the protocol for the returning Belizeans either is going to change or may well change. In fact, I think he went as far as to be definitive. Currently, and we've heard their cries, currently, certainly since last week, the Belizeans who came back had to be quarantined basically for 14 days. Dr. Manza had announced, I think last week, that what he would do to try and shorten that period is to test them at day 7, and if they were negative, at that time we were expecting that you're tested at day 7, your results won't come back for 3 more days or 4 more days. But even so, once you came back negative, you'd be free to go. He's now said, we discussed it this morning, we hear the cries of the Belizeans who say, you put me in quarantine, I have to bear the expenses. There's not really a need for me to spend 14 days in quarantine. So Dr. Manza is going to test them immediately. And if they are negative, they will be allowed to go. Won't even have to wear that monitoring bracelet that you seem to be so concerned about last week. In fact, the way things are looking, we haven't made a final decision, but we're likely to scrap the need for that on the basis that you quite legitimately put forward, saying we might have had an argument, but it's not necessary. Absolutely, you test negative when you return. You're going to be told you're free to go. You're going to be asked to self-isolate for the 14 days. But you're right, it's not going to appear to be fair if you say to those Belizeans, no. When you self-isolate, you're going to have to wear a bracelet, even though all those at-home Belizeans that have proven positive and are not being put in quarantine, that have been told self-isolate at home, won't have to wear a bracelet. You're going to run into difficulties. You're going to face the charge that you're discriminating. So away with the bracelets. We also believe that, given that there are, 12 deaths now, the patterns of behavior, we believe on the part of Belizeans at home and those repats will change. We think that the prospect of dying or of infecting a loved one that will die concentrates the mind wonderfully. And we think that there is progress in terms of the willingness on the part of our public to change their behavior patterns. Also, this is harder to do, but we're stepping up the surveillance. We try to keep records, and so people who are told to self-isolate, if they don't do so, if they're found out and about, or if they're not encountered by the police, but there are reports given and the police are able to confirm this, they're going to be charged. So with all that together, we take your point, sir, and we can assure the repatriating Belizeans that, number one, they will not have to pay for 14 days of quarantine at an hotel, and number two, once they're tested right at the start and found negative and are allowed to go home, they will not even be asked to wear a monitoring bracelet. We will depend on their good sense, and we will depend on the fact that all of us surely by now understand how important it is to play by the rules, as enough of an assurance that we won't have the kind of violation of the self-isolation rule that we earlier would have been very right to fear.
Okay, and then finally, sir, my first, since that requires no follow-up, since there is no argument to be had, we concede so readily. If I could, on the third one, could you speak about the economy? The 23% downturn in GDP has obviously such a frightening effect on the economy, and it's worldwide. But there is also the situation of how it affects the debt to GDP ratio, which must now be 120% or more. And then under that as well, you speak about the situation with the foreign reserve. You were hoping the inflows of assistance from the multilaterals would help to boost those reserves. What right now is the status of those reserves?
Well, I don't have the exact figure for you, but we're certainly not at the point of extreme crisis. As far as I know, the central bank has not yet had to have recourse to its own foreign currency holdings to boost the distribution, the disbursement of foreign currency by the commercial banks. So, of course, it's tight. We always knew that it would be in a scenario where, as you say, there's this huge economic contraction, and contraction by way, in terms of our experts, and in particular, the non-earning of the foreign exchange revenue that we used to get from tourism. So there's no way we can say all is well, but as with all the other problems that we are facing, sir, we are managing. We are managing. We concede the constraints, we concede the constrictions, but we are managing, and I think in the circumstances that is as good as it gets.
If I could, a small follow-up, sir. You know that if you look at the comparative economies, you look at the United States was up 32% in the second quarter, Mexico was up 20%, Barrow close to 30%. Would you speak about the downturn in Belize? Is that what you all were expecting, or was it worse?
I think we were expecting it to be worse, and I'm not quite sure what's responsible for the little bit of a bump, if you can call it that, that we got. A number of people will tell you the closing of the borders, whatever money there is in this country is circulating in the country. Nobody can go to Chetumal, apart from those involved in the illegal trade. Nobody can go to Guatemala, and so all our dollars are being spent here at home. But I wouldn't want to lay claim to some kind of effort that's proven to be very, very successful on the part of government. It's almost happened in terms of happenstance. It's almost occurred by way of happenstance. I think we must give tribute, if not to government, certainly to the Belizean public. You know, take something like the utilities. I know there was an outcry about BL. By the way, I checked with BL, and BL says, man, it is outrageous to suggest that they would be fiddling with the meters and trying to overcharge people. You know, BL is perhaps, well, certainly in terms of its capital structure, its market value, if you will, the largest of the three utility companies. It's also served by an excellent board of directors that has on that board representatives of Fortis. It defies imagination. It's beyond belief to think that BEL would actually try to squeeze people, squeeze consumers in an illegal way. But in any event, my point is that our people are paying their utility bills, you know. The amount of slippage in terms of consumer performance, in terms of people doing the right thing and struggling even in these hard times to keep current with their bills. It is that sort of thing, I believe, that has helped us, and in the same vein, people try to pay their taxes. So, really, the fact that our GDP contraction is not nearly as big as in several other countries, including in the region, I think is a tribute to the Belizean people.
Much thanks to the moderators and yourself, sir.
Yes, Jules, thank you for your 4 questions. Next, we have Paul Lopez, Plus TV.
PM, what was the cabinet's logic behind keeping San Pedro on lockdown? At this time, I think it's a follow-up question to what Courtney had asked earlier. Behind keeping San Pedro on lockdown, and will that be considered anytime soon now that we're seeing the Orange Walk district having as much, if not more cases than we see in San Pedro?
I'm not sure. I'd have to check the numbers up until perhaps this last batch. San Pedro was still not looking well. But I already said that there is no way we expect that the lockdown in San Pedro would continue beyond the life of the current emergency regulations, and that once we have a chance to look at the latest numbers, there is very much a possibility that we would remove them from quarantine even before the natural expiration of that quarantine period.
So as a follow-up, or just for clarification, what's the possibility of the current lockdown, current state of emergency being extended for an additional week or 2?
No, that's what I'm saying. I don't see that at all. I would dismiss that out of hand. I'm saying rather that we are thinking of abbreviating, of shortening the current period of emergency.
Nationally?
No, I thought you were asking particularly about Ambergris Key. Nationally, there is not a countrywide state of emergency. Remember that there is free inter-district movement. It is just that there are prohibitions on certain activities. There is in fact a curfew, but that's not anything like when we locked down in March or April or whenever it was. San Pedro, Amber Whiskey, is under a state of total lockdown. I repeat that I expect that to be lifted before it comes naturally to an end, and certainly there is no thought in my mind at all of extending rather than cutting short that lockdown.
Secondly, considering SIB's recent report, is the reopening of the PGIA, the saving grace of the economy, concerning the numbers? Is it that the PGIA is the saving grace and it is what your government, your administration is depending on to see this decline reverse in GDP, of course?
No, that alone won't do it, for two reasons. The decline is steep, is sharp, even though not as sharp as in other places. So the work of recovery is going to be longer drawn out. That's number one, in any event. Also, recollect that we're starting off relatively slowly. We're starting off with just 2 airlines coming back to Belize on the 1st of October. I repeat that Delta will follow, and those two, of course, as I said, are American Airlines and United. Delta will follow, but not until a little bit after mid-November. I hope, there's nothing to confirm this, that for the reasons I gave, we will see a return of the cruise lines, certainly before the end of the year. But you're not talking about any great outpouring or onrush of robust, absolutely pell-mell type of renewed economic activity. This is going to be relatively slow going, but we are going to be making a start, and over the course of time, we're going to pick ourselves back up. People need to realize that we say it, I suppose, unthinkingly, but on a very serious note, we are a blessed country. With respect to tourism, the fact that it's not going to immediately get on a roll as soon as we reopen will have to do with many things, including that the airlines themselves have to get back up to speed in terms of routes and in terms of profitability and so on. But once global leisure travel gets back to anything like the state it previously was in, Belize is, as usual, poised to be one of the greatest beneficiaries of that. This is a spectacular country, and people will once more be rushing to come to Belize. Agriculture, remember that, and I pay tribute again to the fact that we've been able to unlock the trade in cattle. The Mexicans are coming, the Guatemalans already came and took their first load. The Mexicans are coming on Monday, and they're taking far more than the Guatemalans took, but then there's going to be a second export process to Guatemala of cattle. Agriculture is also a phenomenal mainstay for our country. Apart from the $8 million that's been unlocked by the World Bank, there is this $25 million US agriculture project that the bank has already agreed in principle with Belize. It's going to have to go to the board of directors, and I'm not sure that the monies will be able to be unlocked before the coming of the general elections. But I'm saying that the international financial institutions all believe in this country, because we are so well positioned in terms of our mainstays, tourism, agriculture, that always suffer from vagaries, but all things being equal, and during the good times, those good times will be exceptionally good times for tourism and for agriculture. I have been amazed at the creativity, the ingenuity that Belizeans have displayed. The way regular vendors started marketing themselves online. What we're doing, perhaps by necessity, but I think we're going to do it well in terms of the online learning in schools. Look, we have the kind of country, we have the kind of people that I think amounts to something that always provides us with a firm foundation, with a strong platform for optimism and hope. Jules earlier asked about the debt to GDP ratio. Well, you go and you look at any of the international writing on this issue. Nobody is worried about that. Nobody is worried about that. At the end of the day, because of the global downturn, the usual metrics have gone out the window, and it is conceded, take the particular case of Belize, that once things start getting back to normal, the super bond, in my view, will have to be restructured. And that's going to deal to a large extent with our commercial debt problem. The IFIs, the very monies that they're lending us now, there is already a growing call for those IFIs to in fact engage in debt forgiveness for small countries such as Belize. So in a context where the entire planet has to come together, and where those that control the levers of financing and borrowing and lending have a clear obligation that's being underlined time and again at every international forum, with every international speech that you can view or listen to. There is going to be a way of getting the kind of relief from what in normal terms would be an astronomical debt to GDP ratio. There is going to be a way, there are going to be several ways of dealing with this, such that in the, not necessarily in the short term, but at least in the immediate term, this country is going to bounce back and is going to be once again on a firm growth trajectory.
PM, thank you. Are you saying in essence that there isn't necessarily a way to calculate whether or not this decline will continue into a third quarter, something that I'm sure your administration or any Belizean wants to see?
No, there's no doubt that we're not going to turn it around before the end of the year. The year is shut, and again, this is happening with economies all over the world. There is no way we can get back so that the annualized GDP will be positive. That's out of the question. But I'm saying as from next year, and again, no, we don't know how long the virus will last, but look at the Abbott Labs breakthrough. Look at how much closer it appears that we're getting to a vaccine. So next year, this thing will, if not, if it won't be totally ended, it will be certainly far more contained than we can imagine just at the moment. And that's when the process of international reconstruction that is something, a phenomenon that our national reconstruction will play into. That's when that process is going to begin. So while I have to caution that we cannot be premature, we cannot be hasty in thinking that we will rebound in the next quarter or the first quarter of 2021. Rebound there will be for sure, and in that process we are not going to be alone.
You made mention of a new approach to determining a recovered patient, which the new approach is now that you do one test, and if that test proves to be, if that test says negative, that person is being recovered. I think that earlier on, at the onset of the pandemic, one of the reasons why 2 tests were being done was because of this whole issue and concern with false negatives, and that 2 testing kind of address that uncertainty. So now, how do you address the uncertainties that may arise where false negatives is concerned before releasing a patient back into society?
2 things. Actually, no, false negative would not be the term you would apply once you get a negative at day 14. And this is also, you have to look at what we know now versus what we knew then. As a matter of fact, take it further. In the past, we used to also do a test to screen for SARS-CoV-2, and then you do a confirmatory test. The new WHO guidelines actually state that if you have identified SARS-CoV-2 in the first test, you really don't have to do a confirmatory test anymore. We are still doing that at the lab. The reason why we only do 1 is because some other countries have now moved to not even doing any. In Belize, we have decided to keep 1. And I think I went through that explanation process last week. But also because beyond 14 days, people are not routinely going to be carriers or spreaders of the virus. So what the data is suggesting is that after day 14, what you will be finding is more than likely residual viral particles, but not enough or evidence to consider them as spreading. So beyond day 14, then the risk is a low risk. You're not really going to be spreading any situation, and that's the reason why we moved to 1. As I said, other countries after day 14, they are just putting it as a recovered case, not going back to testing it.
Okay, thank you, Paul. Next up, Urson Picard, Creme.
Yes, hi, good afternoon to the head table. Let me kick it off first with the Prime Minister. Based on your announcement, it seems that you might be hinging the reopening, from my understanding at least, you might be hinging the reopening of the Pgia on the expected availability of this 15-minute COVID-19 antigen test about by now. If I'm wrong, kind of correct me in your response, but are you or the health professionals at the head table not concerned that this US-based company, having only received recently acquired emergency use authorization from the FDA for this product, and that is authorization based on what some might say political pressure in the US and a sense of urgency in that country to get its citizens back to work, even though they have poorly managed this pandemic?
No, also you're wrong in terms of suggesting that the greatest incentive for us to reopen the airport on October 1st is the possible availability of the Abbott Labs antigen rapid test. Look, even without that, because we are able to source the biosensor antigen rapid tests that PAHO has given this qualified approval to, we can always use that in place of the Abbott Lab test if that's not available by the time we reopen. Remember also, though, that as the medical gentleman explained to you, we have a number of gene expert PCR tests. We have, by the time the second batch comes, Dr. Manza had said around the middle of September, we would have basically 2,000 or so of those. We can always start with that. Currently, the gene expert PCR test, which is quicker than the regular PCR test, is being used by Dr. Manza and his team to test health professionals. If we, because now we're going to use the antigen rapid test on the general population, at least insofar as two subsets of the general population are concerned. That is, you're walking around and you're clearly symptomatic, you're exhibiting symptoms, or number two, you're the contact of somebody that's been tested positive. That will ease the pressure on the PCR tests, including the gene expert rapid PCR test. The bottom line is we will have enough of the gene expert rapid tests to be able to begin when the Pgia reopens on October 1st, to begin the testing of Belizeans with that gene expert rapid test, rapid PCR test. But I still say that while that is our backstop, if you will, it cannot be in any sense misguided for us to factor in the availability of the Abbott Labs Biomax rapid test. Remember, I'm not suggesting that the Biomax rapid test will help us, because we will be able to procure those tests to administer them at the PGIA. I was very careful to say the people that are coming, both the tourists and returning Belizeans, will be able to procure them in the U.S. You're right, the U.S. is cornering the market on this. As I said, Trump is looking to spend untold millions of dollars so that certainly the great bulk of what is being produced will be for the U.S. market. But they're going to be producing so much that it will not be a matter of any difficulty for the tourists that are coming, for the Belizeans who live in the States that are repatriating, to bring an Abbott Lab test with them. So that is the distinction. The use of that test does not depend on our being able to purchase those tests out of the U.S. We fully understand and accept that that might not be initially possible. But the people that are coming from the States are able to do so, and so that obviously is going to be a crucial factor. But at the end of the day, I repeat, we can make a start even if nobody that's coming can bring an Abbott Labs test. We have enough testing resources in country to make a firm, safe start with the reopening by employing our own local testing resources.
PM, on Friday last week we had the other press conference. I had inquired about the change that oral petition for BEL. I know you sort of alluded to it when Jules, in a response to a question to Jules, but you didn't get into any specific details. I know that as it currently stands, public sector interest amounts to 63.8% of shared ownership in BEL, with government of Belize as 32.6%. Right now, this particular petition is at 5,206 persons have signed this petition, and I would really want to believe that over 5,000 Belizeans are knocking their head or they're going to get crazy with the increases in electricity bill. Knowing that this amount of people have signed on to this petition, is not our government obligated to look into it seriously? I know that the folks at Media were on a morning show. It may have been this morning or yesterday morning, but they were just trying to push their narrative. People have real questions, and people are seeing the increases in the electricity there, and they frankly want answers, good sir.
Well, I spoke certainly to the CEO of BL, and he says their comparative analysis shows that over the same period last year, there's not any substantial difference with the bills, you know. But fine, I hear you that you don't necessarily want to take his word for it. There is the regulatory body, the Public Utilities Commission, and I am sure that I would have no difficulty, and that BL would have no difficulty, if the PUC were to, in fact, institute some kind of an investigation. But all I'm saying to you is, not trying to cast aside, not trying to be dismissive at all of the concerns of the consumers that have signed on to this petition. I find it difficult to accept that BEL, you know what, is engaged in a conspiracy to rip off consumers. You know, that would be a giant-sized conspiracy. You know how many people would have to be involved at the level of the meter reader, at the level of the billing clerks, at the level of large portions of the work staff who have relatives in this country that are consumers, you know. So they would be part of a conspiracy that's going to also rip off their family members. I tell you again, look at the management of BL, look at the board of directors. There are people on that board that, well, maybe I'm biased, but the chairman of the board is Rodwell Williams. You can't find a straighter person than Rodwell, but as I said, perhaps...
I'm sure it's not a conspiracy, perhaps it would warrant an investigation to allay concern.
Well, I'm telling you that there's not a problem with an investigation, but the sense I was getting is that people are crying conspiracy. Take somebody like Kay Menzies. My God, man, ex-president of the Chamber of Commerce. She's a representative on the board of Fortis, you know. Alan Slusher, the ex-governor of the Central Bank. You cannot convince me that these people would willfully engage in any kind of wrongdoing so as to prejudice consumers. Now that things can go wrong, I concede, and that's why I'm telling you. I certainly would not be afraid of any kind of PUC inquiry, and BEL would not be afraid of any such inquiry.
And then PM, general elections, if all goes well, should be slated for sometime in November. I know that the Dominican Republic and several Latin American countries have had elections earlier this year. Is there any move to get the Elections and Boundaries Commission to put in place determined sanitization protocols for the elections process that will be coming up later on this year, and to publicize those protocols so that our people are well aware of what is expected of them? Final question. Thank you.
Thank you. I think that's very important, and I'm sure that the Elections and Boundaries Office, together with the Commission, will in fact be putting out the protocols that will have to apply to govern the elections process. What I can tell you is that there is absolutely no thought of seeking to postpone those elections, and so we know that the obligation rather is to ensure that we can have as safe an elections process as possible.
Aaron Humes.
Let me start with Dr. Manzanero on an issue that has been particularly troubling in the recent and especially with the rise in deaths recently, and that's the issue of ventilators. You've explained, and I trust your science on this, that the ventilator is the last option for persons with respiratory issues and indeed those with pre-existing conditions that would be susceptible to COVID-19. Please give us some detail as to what the decision-making process is, if you will, for ventilator usage, given that so many still believe that ventilators, when you're put on one, is effectively a death sentence.
Well, I don't know if it's a death sentence. I think that the fact that you require a ventilator, you're already in a very precarious medical condition, and that's the reason why you go on a ventilator. So you don't want to put people on ventilation, but that's a requirement. And it's not only for people who have a respiratory situation, but people who have sepsis, people who have a myocardial infarction or having cardiac failure. Those are people you're going to eventually can be placed on a ventilator. Right now, 3 persons are ventilated out of the cardiologist's capacity for 16. You also would know that some people, on average, can be up to 3 weeks in a ventilator. One of the patients has been there for more than 2 weeks, and the other person has been there for more than a week. And the medical professional, 24 hours now. I mean, you ideally try to not have to place anybody on a ventilator, but I think the gist of what you're also asking is what happens once you reach your ventilation capacity. Let's say you have 14 used and you only have 2 pending and you may require 4. Cardiologist has already set up their own internal ethics committee. Their first meeting is next week, Monday or Tuesday. I will sit on that committee. I actually helped cardiologist in the drafting of the terms of reference, because that is a sticking point that not only Belize is going to go through, but all countries are going through in terms of what eventually you require, what ethical issues you will have to put in play if that ever comes to a requirement. So we have not needed that, but you eventually have to prepare for that as well.
Thanks, Doug. Prime Minister, and if Dr. Bob is still there, Dr. Bob as well. My second question has to do with the investigation into what took place in Independence, and that tugboat situation that led to several persons being infected and charges for the various individuals. What was the final analysis of what happened? Because there were, of course, multiple complaints from customs and from port authorities.
Monday, that's you, though.
Good afternoon. Okay, from what we have been involved from the Ministry of Health perspective is that we know for a fact that we wanted to make sure we safeguard the community. That was our priority first in the Ministry of Health. We found out that 5 of the crew members that should have remained on the tugboat and waited for their test results had somehow been sent home or left to go home. I have to be careful with my words. I would want to say that they went home for a few hours until my counterparts, my colleagues, the doctor, the administrator, was alerted because one of the 5 resulted in being ill. So the employer was notified, the other 4 members were brought to the clinic, did an exam, and we returned them back to their quarantine. And the member that was ill, we brought him into our clinic, and that very night he complicated and we took him down to Dangriga. And I'm not sure if he continued on to Belize. As you know, the 5 members resulted being positive. With that, well, obviously we had to go back into the 5 families, and I'm sure some contact tracing was done and some testing. And I think we managed to avert something that could have been, well, catastrophic, 5 positive members in a community in 5 different families. We possibly could have had another San Pedro or another Orange Walk. For the charges, I know that the Commissioner of Police did his due diligence. I know from my part, I was asked to produce 4 reports, my public health inspector, my doctor that did the swabbing there at Independence, my administrator, and then my chief public health official, Mr. Borden, who's responsible for the PHI, the public health inspector in the Independence region. All reports were forwarded to the inspector and to the commissioner. And obviously the 5 crew members that came off the tug, our priority was first to make sure that they were safe. Our priority was to make sure that they remain in quarantine, to watch their health. I think they're finishing up their quarantine. I'm not sure if they've been retested. And then whatever charges, I'm sure the commissioner under the Quarantine Act will come forward. What we did immediately was, because there was a confusion about who had given them the authority to go where, was that they had been doing a series of trips. Because remember, under the quarantine structure, we did not interfere with trade or commerce. So this tugboat would leave with the clearance of the Port Authority and all the relative authorities to go and take the barge. It just happened that this trip was not a commercial trip. This was a maintenance trip to a different destination. Instead of Guatemala or Puerto Cortes, it was to the Bay Islands of Honduras, to Roatan. With that said and done, they had to continue their movements. So very reluctantly, we had to agree on a protocol, which was that the company agreed that the members on that, the new members that were going to be the crew of that tugboat, would then go with their barge wherever. They would follow these protocols that Mr. Borden had shared with the company, whatever measures they had to take to protect themselves, like they're going with the tug, not to get off the tug if they're in Guatemala, to make sure is there's no contact with nobody else, just go leave the barge, pick up the barge, come back. But when they came back, we agreed that they would have to stay on the tugboat, or the company would have to create a small isolation unit for them. Because no use they do a 5-day trip and they come back and we have to run to swab them every time after 5 days, because we still are going to demand the 14 days quarantine. So I think the company has worked out that when the crew goes, it goes for a couple trips. Let's say they work 5, 8, 10 trips for a period of 3-4 weeks, and then we would swab them now, and then we would quarantine them 14 days, and then they would be able to go back into the community, and then a new crew would go on that tug. So that's where we are. All reports have been forwarded to the commissioner. A new protocol has been put in place. Trade continues, and whatever the commissioner of police decides, well, we have to respect that.
Excellent response, Dr. Dawes. Prime Minister, I think you had also conversation to follow up on the matter of one of the private that came to Belize in July from Branson, Missouri. Have you been able to find out what the pattern of that person was that came in here, a person, and how that contributed to what happened on the rescue?
I'm sorry, I don't want to delay. I have all the information on my phone, but I had expected the question last week, and you people lulled me into a false sense of complacency that it was an issue that was no longer on your radar. Anyway, from memory, I have the name of the individual that came. I think the flight originated out of St. Louis. There is no question but that in terms of getting the clearance for the flight, Minister Heredia from San Pedro did assist. He makes no apologies about that, because the person who came is a significant investor in Hamburg Whiskey. He has a $20-odd million investment called Salt something. Again, it's a pity that you never asked last week when I had all the information to hand. But in any event, that's easily, I can send it to you afterwards, the name of the investment, the tourism investment that the individual has going on Hamburg Whiskey. And he also owns 2 additional premises. He's the owner of a penthouse and he is the owner of a condo. His itinerary was such that he had come to check on the new investment that had been started, into which I'm told already $20 million have been poured, but he stayed at his condo, which is maybe a mile or so away from the site of the investment, the new investment. He limited himself to going back and forth between the two places, as far as we can tell, and after something like 10 days or so, he went back out of the country. There was no question of his circulating in the wider amber whiskey community, and based on the protocol that we had developed and about which we spoke in some detail last week, there was nothing wrong with that flight. There was no lapse of judgment, there was no omission, there was no violation of any of the rules. End of story.
Next up, Isane Kaitano.
Afternoon.
I wanted to, first of all, revisit the issue of the number of cases and what seems to be a day-by-day increase in the organ blocks, and whether or not it poses a concern for the government enough to deal with organ block separately in terms of trying to mitigate the spread there, either through special state of emergency for the district or whatever other measures come in place to stem the spread of COVID-19 in that district.
No, Isani, I don't see that as being in the offing at all. We went as far as I thought we should have with respect to quarantining some of the individual villages. They are now off of quarantine. I don't see trying to lock down the entire Orange Walk district. I take some comfort from the fact that, as I keep repeating, the doctors Manzanero make the point that we seem to be working through the list of contacts of the original positives. And as we continue working through those lists of contacts, there will be more cases turning up, traceable ultimately back to the original cluster or the original outbreak. I don't get the sense from the doctors that separate and apart from that, there is any preponderance of new cases. In other words, if in the main you can trace everything that's happening back to the original cluster, we hope that by now we're getting that cluster or that community spread under control, and there is, in my view, no reason to lock down the district. I had said last week, and I felt fortified by the WHO guidance that was issued, you do not resort to a lockdown as a kind of default option. You have to think very carefully. You want to try and put safety first, but you also must be conscious of the tremendous havoc that's wreaked once you lock down a district, once you lock down two districts, once you lock down the entire country. We have got to learn to live with this pandemic, and I believe that slowly but surely we are coming to terms with it. The tragic deaths have only not been tragic in one sense, that I think they've had a salutary effect on the thinking and on the behavior patterns of our people. Once we are going to now reform our behavior and try to stick to the rules that are in place that fall short of a total lockdown, but that are helpful and that do assist in containing the spread, there will not be a need to go to a total lockdown. That can change. I don't see it happening.
My second question has to do with the Philippines International Airport and the fixed date for the reopening. It's more of the assurance that we are now on track for October 1st, notwithstanding any spike in cases during that time, correct?
Yes, you're absolutely right. You're absolutely right.
Can you expand on that in the sense that we're looking at what some would say is a second wave where the numbers continue to rise? Does this have an effect, or would this have any foreseeable effect on the reopening for the 1st of October?
Well, if the numbers begin to get into the stratosphere, there's no way you can ignore a hard reality such as that. But I don't see that happening. And I'm telling you that, again, I take great comfort from what I hear from the doctors. We seem to be coming to the end of the line in terms of the contact tracing, which is a manifold process, because you test one set of contacts, you're sure to find more positives, and then you have to test the contacts of those additional positives. So it's not going to come to a complete halt tomorrow or next week, but I do get the sense that that great big huddle of persons that are at risk and that may be positive is thinning out. And so I am optimistic that we're not going to see the kind of, comparatively speaking, overwhelming numbers to which we were subjected to over the past 3 weeks or a month or so. If, I repeat, something changes fundamentally, if my sense that we're beginning to plateau proves completely wrong, and if instead of plateauing, we find that there is a surge that's perhaps 3 times or 4 times or 10 times, God forbid, as big as the surge off which I think we're now coming, then of course we have to return to the drawing boards. But I don't see it happening, and that is why I say with every confidence, every conviction, that we are going to reopen that airport on October 1.
Perfect. Thank you. Good afternoon.
Right, next we have Dion Banson.
Good afternoon.
Good afternoon.
I have some very short questions. First one will be to Dr. Manzanero. Doctor, we've been seeing complaints to the island for the past weeks that not enough testing has been done on the island, and that's why we're having less positive cases. But given the fact now that we could get access to this rapid test, or we will have the results in less time, does that mean that we will also see an increase in testing on the island? I think more swabbing on the island, and almost everybody who shows up at the clinic saying that they feel like they have been in contact with somebody or they feel tested.
Yeah, well, the actual validation of the rapid test would be done through this weekend or early next week. We have validated one previous rapid test, but we don't have that amount in country as yet. So we do have the other amount of 5,000, which would go through a validation process. We did discuss earlier that San Pedro, given that they have community transmission, would be the ideal place to do what you call field testing of the rapid test, which also needs to go through a validation process. And I'm not so sure that testing is not being done. If you still see the numbers throughout this week, the numbers have continued to increase for San Pedro. So amount of tests might not necessarily be what you would have anticipated, but testing hasn't really stopped in San Pedro.
But I'm sorry, I mean, I don't want to... I even appear to be putting a gloss on what Dr. Manza said, but I need to make clear that my own position, and I thought indeed that was what was agreed at the pre-press conference meeting we had, my own position is that what you're asking is entirely legitimate, and that indeed more testing could now be done in Ambergrisky by way of the antigen rapid tests. Doctor is right, there has been no validation of the biosensor rapid tests that I am saying that we need to use. But if even PAHO is telling you that it's okay to use those rapid tests on two subsets of the population, just what you talk about, Mr. Vance. People that are ambulatory, that are able to walk around, and I use the term because that's exactly the word employed by the PAHO report. People who are walking around, who can go to the flu clinics, who are exhibiting symptoms, who are saying that they feel ill. That's precisely the first group that PAHO is recommending that you test by way of the antigen rapid test. And the second group is the contacts of those that have already proven positive by way of the PCR test. So I hear Dr. Manza, and I hope that then the additional validation that he is looking to do on this biosensor, a test recommended in quotation marks by PAHO, is not a validation that will take long, because the whole idea is to do precisely what you described as the objective, to be able to perform tests now extremely quickly on those that say, I come into the flu clinic because I'm exhibiting symptoms, and to know that they will get their results in 15 minutes, and to ease, as a consequence of that, the pressures on the PCR tests, which pressure produced the problems that we were experiencing. I hear the doctors saying we are working through those problems, but to solve the problems, to work through them particularly quickly, it strikes me that the use of the antigen rapid test is indispensable. So I express the sincere hope that whatever additional validation Dr. Manza is proposing to do will be quickly done, so that the answer to your question can be, even if it's in a day or two from now, yes, there will be additional testing in a voluminous way in consequence of our deciding now that we can use the biosensor antigen rapid test.
Thank you. And the next one, for you, Mr. Prime Minister. There is, since we heard from you that the lockdown could be lifted before it expires next week. In that case, is there a plan from the government how to reopen the island and to make sure that the island doesn't get infected again? Because if we open up, they will come from mainland, they come from everywhere. Somebody again could bring the virus, and then if there is another outbreak, then the island will be placed on lockdown. And the concern from residents is that they feel like they cannot really afford another lockdown. There has been, a cry from the public on the island that, we are in need help, and they want the government to, to really look at the island and listen to their cries, to put a plan how to help all those businesses and residents that are going through hardships because of the lockdown. And so so it is important to know the areas of land as to how to control the flow of people to the island, to make sure that they are well screened and that we don't have a repeat again and go back to square one.
But sir, with the best will in the world, I have to say, there seems to be a contradiction in terms. You are asking for the quarantine to be lifted because of the tremendous hardships that the quarantine causes. At the same time, you're saying, when you lift the quarantine, find a way to stop people from coming to the island. That's the only way to stop them. If the island is quarantined and entrance to the island and exit from the island are both prohibited. You can't have it any other way. So the best I can tell you is that I agree. And I said at the end of this, I will check with the doctors as to the numbers in San Pedro. I am inclined to lift the quarantine perhaps on Monday, maybe just have the weekend pass and lift it on Monday. But I do want to check the numbers with the doctors. But once we do that, the question of another outbreak on the island is something that of course will be possible. The only way to try to stop that is if you seal off the island, and lifting the quarantine means that you are refraining from sealing off the island. What then are you left with? Again, the question of the patterns of behavior. My God, you want the island reopened so that commerce can begin, and commerce brings business and other interaction, so that in fact there can be the return to a semblance of life as normal. Well, life as normal would mean that people will be free to come and go. I repeat, the only way to try to ensure that that reopening does not result in quick order in some kind of return to an outbreak of the virus is for people to observe the rules. Every time Dr. Manza goes and asks the experts, he reiterates all that we need to do. And the public service announcements are thick and fast in that regard. People have to begin to adhere to those rules. I need to be careful. I don't want to suggest that at all Ambergris-Key is guilty of any kind of loose behavior in terms of not following rules. But since it appears that the whole country has not been as disciplined as it ought to have been with respect to these rules, I will make a special plea. I will enter a special appeal with respect to Ambergris-Key that since you've helped to set the pace for what happens when we are lax, that you turn right around now and become the model, become the template of the kind of proper behavior and observance of the rules that basically are what will succeed in preventing another outbreak in your Isla Bonita.
And the last thing for me is, if the lockdown continues until it expires, will there be any consideration to allow an internal reopening, like for example, allow people to work, like construction?
Oh yes, man, absolutely. Once the quarantine is lifted, you are subject only to the rules that apply countrywide, and those rules have to do with things like bars. So bars will not be allowed to reopen, but construction activities is in fact allowed everywhere in Belize. So it would be no different in Ambergris-Key, in San Pedro. You might have a problem with the fact that the restriction on bars will still be in place, even after the current regime in terms of the regulations expires. We're not going to go back to simply throwing open the bars. The bars in particular are a source of great concern to Dr. Marvin. He said this to me time and again. But you will not be subject to any restrictions other than the general restrictions that apply to the entire country. You'll be expected, of course, to observe the social gathering restrictions, not more than 10, what applies with respect to social distancing, that sort of thing. But there will be nothing particularly onerous, such as would interfere with commerce, with economic activity, which is the lifeblood of Ambergris Scheme.
Thank you, Dion. Next, we have CTV3.
Hi, good afternoon. Ron Anderson, CTV3. My first question is for Dr. Manzanero. Sir, can you provide us with information as it relates to the most recent death of COVID-19 here in Orange, the male person who died at private facility in Belize today?
Yeah, well, the notes we have is a male, he died at a private facility, he was seeking care for some cardiac condition from Indian Creek, Orange Walk. We had actually gotten a note that his death certificate had not made a mention of SARS-CoV-2 because the diagnosis was made post-mortem. So I haven't actually seen the death certificate, but I know it will be rectified because it needs to be cited as a contributing cause of death. But I don't have any other particulars as to what actually led to his death at the private facility in Belize City. He died in Belize City, actually, not in Orange Walk.
I didn't hear your first part of the question, but I think you're asking what do we expect with this, with what has been happening throughout the week? Is that more or less okay?
Given that more results are expected.
Yeah, yes, indeed. In this entire week, our surveillance officer actually went to, with the Orange Walk team, to the different villages. We do know that they were in San Felipe, San Jose, Santa Marta, doing a sweep of the cases who are symptomatic, and of course the contacts of those who are already positive. And we did gather that there are close to over 200 swabs have been submitted. So those amount of tests are now at the central lab. We do expect that there will be an increase of cases to be reported from these areas. So in the coming day or throughout the weekend, we will see a bigger number for these areas as well. So that's the scenario. So we do expect to have an increase in numbers for those specific areas.
My second question is for the Director of Conservatives. Sir, can you give us an update on the situation at Caribbean Chicken? We know that the plant remains closed and that decision was taken after an employee had tested positive for COVID-19. Are you able to say when that they're expected to get the outbreak to reopen?
Well, there's a processes that need to be followed. I know the Principal Public Health Inspector, Mr. Bowden, was due to go to inspect the facility along with Baja today. So I guess once you review that they have met the requirements, then you can give them the clearance. We had discussed with the manager that it might even be that certain areas of the facility might be open, not the entire facility, depending on what we find, and also contingent on the amount of people that are ill or having signs and symptoms from the facility, because if you have people that are having temperature or having respiratory symptoms, they obviously should not be going to work. And I think that's going to be the challenge as we move along in terms of workplaces. I think you saw that BSI, I think that's the name, announced just yesterday that they had 2 cases yesterday, and so they are taking the necessary precautions. So I think it's a matter that we'll have to revisit with major employers as we move along.
Okay, my final question is for the Prime Minister. PM, with the closure of the prevention plant in Blue Creek, are we looking at any assistance for employees who are affected by this closure?
I'm sure they will qualify depending on the length of the closure. Dr. Manza just said that there is a mission currently doing the inspection. I would think, especially because he intimated that at the very least there's likely to be a reopening of sections of the plant, if not the entire plant, that the fallout won't be prolonged, won't be too extreme. But to the extent that people do lose jobs, that is exactly what the unemployment relief program is there for.
Thank you, sir.
Right, thank you very much. I believe that brings us to the end of today's press briefing. Thank you, PM. Thank you, Drs. Manzanero and Dr. Goff. Thank you again for tuning in. Have a good day and a good weekend.